A different view of the adductor drop test is shown here. Again, I'm going to lay down on my left-hand side to test the relationship of my right leg and my right hip socket. So I will turn this way, and I will go into a 90-90 position. You can use a towel under your rib cage, you can use a towel under your head, whatever makes you feel comfortable. From here, I will keep the 90 degrees at my knee, and I will shift this leg back so it is pointing directly out towards the wall. Please don't go too far back, otherwise this is very difficult. From here, I will let gravity take over and see if the inside of this right knee will touch the ground. In this case, the knee does touch the ground. That is a negative test, meaning there was no difficulty in doing it. Typical compensations are either the knee stays off the ground, here, or as you start to lower yourself, lower this leg, it pulls forward in order to touch the ground. These would be positive tests, meaning it was not possible for you to do the movement easily.